this is Mariko, the pharmacist. Thank you so much for watching. Please make sure you subscribe to this channel, like the video, and share it. Today we'll be talking about a constipation medication. So before we jump into it, I'm going to put up my disclaimer statement. So feel free to pause the screen when I put it up so you can have ample time to read through it before moving forward. So Miralax, and I do know this says Clearlax, but this is a generic version of Miralax. And if you look at the statement here, it's just letting you know that you can compare this to Miralax. If you turn it around, you can see the active ingredient, which is polyethylene glycol 3350. And if you go to the drugstore and you pick up the bottle from the Miralax bottle, you should see the same active ingredient. So if you prefer to get Miralax, that's fine. I normally like to get the generic versions. So Miralax is used for constipation, and it is considered a laxative. So what is constipation? So constipation is when you have 3 or less stools per week. And when you go, if you go, you find yourself straining because it's very difficult to get the stool to pass because it's so hard and dry. And so if you find yourself constipated, before you take the easy way out and go to the drugstore to pick up a laxative, I want you to ask yourself some questions. First question, ask yourself, why am I constipated? And then 2, ask yourself, am I eating the right foods that my body needs to promote a consistently good bowel movement? And then the next question, am I going when I have to go? Because if you're not, then that is a problem, especially when you're not going, when you're fighting the urge consistently. Because what happens is that it has a negative impact on the rectal muscles. And over time, the rectal muscles become less effective at eliminating your stool. And then the third question, which is my favorite question, could it be a prescription or another over-the-counter medication that I'm taking regularly? Could one of those be the culprit? Could one of those be contributing to this constipation? So those are definitely good questions. And a lot of times, if you're taking a prescription medication, you just cannot stop taking your prescription medication without getting medical advice. So in those type of situations, you can definitely check with your pharmacist or your healthcare provider and ask them what are your options as far as maybe decreasing something or switching to another medication. And if you cannot switch to another prescription medication, then at that time they may say that it's okay to get an over-the-counter laxative. And then think about your diet. So if you can make changes in your diet and make sure you're eating the right foods and doing the right things to help have good bowel movements, then do that first, if it's possible, before you just pick up a laxative. Let's talk about how Miralax works. So Miralax, it basically works by drawing water into your colon, which results in the stool retaining water. It stimulates a bowel movement, and then it increases stool frequency. So basically, Miralax helps to soften the stool, and it makes it easier for you to go. So make sure that while you're taking this medication, unless you have some type of fluid restriction, make sure that you stay hydrated while you're taking this medication. And it's very important to realize how long that this medication may take to work. So you can expect some results in maybe about half a day to up to 4 days. So that's very important to know. So while you're waiting on some results and taking it as directed on the label, do not take extra doses because you think it's going to help speed the process along. Because what is going to happen is that you're going to have a mess on your hands, or I guess I should say a mess in your pants, because it may result in diarrhea if you're taking more doses than you should be. So now let's talk about when it is not appropriate to use Miralax. If you have severe abdominal pain or cramping, if you have bloody or dark stools, nausea and vomiting, if you have noticed changes in how often you go, or maybe even changes in the consistency of the stool, especially if that's going along with, you've noticed some weight loss that was unintended. If you have an inflammatory bowel disease, or if you have are underweight or have an eating disorder, then this will not be appropriate for you at this time. And if you have any of those things that I just mentioned, you really need to see your healthcare provider, because the concern is that there may be some more serious issues going on that really need to be addressed by a medical provider, rather than just trying to fix it with the over-the-counter laxative without seeking medical advice first. And though also those things that I just mentioned, that will go for any laxative, because those things are of concern. But thank you so much for watching. Please make sure you subscribe to this channel, like the video, and share the video. Also, make sure you put comments so I have an idea if you liked it or if it was helpful or not. If there's a specific over-the-counter drug that you'd like to know a little bit more about, make sure you include that in the comments. Thank you.